Okay, so I reorganised it, and I forgot to mention what else I have in here. So the snapping tools I mentioned when I was at the practice nurses. These are the fancy little things. So I'll show you the smaller one first. So the smaller one is like this. On the inside looks, so obviously the ampule goes in there. You have a nice little indicator. Let it figure out. It's not figuring out, but there we go. So you have a line, so obviously you pop your ampule in and then snap it away. Shows you where to snap it away. So obviously that's for your smaller one, and then this is for your bigger one, sort of thing. Obviously you can see. So dead easy. I think they cost me like $5.99, $9.99. But you know what? Even if you don't want to spend money on it, you can use syringes, obviously 2.5ml and a 5ml syringe. But dead easy. So I'm going to put that back in my bag because I've organised it now. My mum also got me, and bless her, but my uniform doesn't have it, but it does on like my healthcare uniform, so I do use them. I use my purple one more than this one. So this is a pink pen organiser. Clips into like here if you have the pockets on here, but obviously my student uniform doesn't have it up there. They always have just the bottom pockets, which I think is a bit poo, but there we go. So yeah, that's always handy. I also carry, I suffer with back pain, so a bit of deep relief. So obviously if your muscles are aching and stuff, I just throw a little bit on. Also, so important, Mr. Felt watch. I know this is not the right time and I need to get a new battery for it, but when I hook it on, I always hook it so it's this way, so I'm not clock watching, and then if I need to go, oh, what's the time, I'll just flop it up, sort of thing. Dead simple. So what else do I have in my front little pocket? So I'm such a bad person for this, and I think everybody else is as well, so hey ho. Right, so I have, what's this one? Bit of Gabby Penton. So obviously with my back, I will take that if I need to. Hardly take it really, but if I need to, I will. Some hair clips, because you never know when you need to slide that hair away. What do I have here? Ibuprofen. Bit of ibuprofen, can't go wrong. Again, usually in the back, sometimes headache. And I'm so awful for this. Amoxicillin, envy. So obviously you can see, we all get run down, we all get ill. I'm going to take them out of my bag because they shouldn't be in my bag. So yeah, nobody ever finishes the course, even though you should. Always should finish the course, but you never ever finish the course. So, in my main bit here, so absolutely vital and lifesaver. I don't even know where I accumulated this book from. I'll move my bag out of the way so you can actually see. And I'll open it up and turn it around. So, actually I don't think I can turn it around, but there we go. I'll just use it. So my little zebra book, absolutely fantastic. When you're on a placement, I always think it's important to write down what you've looked at, if you've seen anything, if you've done anything, take notes. Obviously I never put anything about patients in here. Let me go through and see. So what's this one from? So this is from the practice nurse when I think it started it all. So like, ignore obviously all my dodgy writing. So diabetics, obviously when I learned about diabetics with the practice nurses, I was able to write what tests they did, so obviously I was able to understand the difference between type 1 type 2, what blood tests they did, how long does it take, can you reverse from being like a type 1 or a type 2, but obviously you can only reverse a type 2, not a type 1. What blood tests are, obviously the HbA1c, arthritis. I learned about that because you don't get told a lot about it. You learn about like rheumatoid arthritis, but not really about arthritis in general, sort of thing. I've never done an arthritis place, but it'd be good to go and see one. So obviously what drugs are used for that, obviously anticoagulants, so important that you know obviously what they're on, what they're prescribed, sort of thing, because obviously your INRs, I didn't understand all the INRs, how they put the data on, sort of thing, how they work out what milligram you should be on per day, overall per week, and then obviously come back, get your little INR test again, which is a nice little finger prick. A lot more harsher than your normal finger prick, because obviously you've got to bleed, make sure they bleed, and obviously do a range sort of thing, but they're absolutely amazing to watch it out. I've got obviously in here my nurse was absolutely fabulous with me. So iron ore calculations, so obviously number of milligrams divided by the number of the days equals your dose sort of thing. So obviously your average, how many milligrams you've had per week sort of thing, how many days, and then obviously it gives you the dose. So if they were on 11 milligrams divided by 4, so it's 2.75, so then the tablet would be like a 2.8 milligram, but they don't do 2.8, so it'd have to be a 3 milligram tablet per day sort of thing. So it's kind of good. My finger keeps getting stuck in this book, but hey, bear with me, I'll get there. It's because I'm lifting it up and showing you guys. What else? Through. I'm going to talk about that in a minute. Pacemakers as well. Never really do a lot about that either. We do a lot of cardiac, but pacemakers obviously is like, kind of didn't realise until like 3rd year, like now, how important they are and everything else, but I think it's all to do with placement. Obviously I'm gonna write about my favourite placement of like all time, but yeah, I write down pretty much, as you can see, notes of stuff, every single placement that I've been on, so it's kind of nice to like flick back and see what's what. If I get given anything, I'll pop it in. I'm not going to find out where that went. I'll pop it in and make sure that I write notes on it, which I have. I always get frustrated that, you know, if I write something and it's not how I want it to be written, take it off. If notes have been given from my mentor